Hello, I'm Dr. Asma this side, and who is with me? I can see Isaac is with me, Rajini, Anam, Dr. Deepika, and Maya, Rekha, Aliza. How are you guys? A very warm welcome from my side. I'm Dr. Asma Shahnawaz this side.
Me fine, ma'am.
Hello, ma'am.
Hello. How
Good
the
afternoon.
preparation is going for MRCOG Part 3, friends?
Yes, we are doing, ma'am.
Why you
Yes.
people are so? It means preparation is going very well, right?
Ma'am,
Ma'am,
it
the
will depend
results will
on
show
result.
us that results.
Actually, you people have noticed that this preparation is quite different than part 2, right?
Very
Yes, ma'am.
different.
Part two, I think it easy as compared to part three.
Uh, no, actually, part 2 preparation is a bit tough in a sense that you people are alone and you are just continuously sitting and just studying a lot of things. But part 3 involves many aspects in your preparation, right?
Yes, ma'am. So many domains we have to cover.
Yeah, exactly. And you know that when I started preparation, first of all, Deepika and everyone, let me introduce myself. I'm a member of Royal College of Obstetricians and the gynecologists. And what my preparation was that I was actually told that part 3 is all about communication. But you know that when I really went through the exam, I recognized that and I realized that it's not actually about the communication only. It's whole scenario, like including everything, your complete clinical knowledge about the scenario, about the patient, about the management of the patient, including communication, including all the aspects of the patient safety. When all the picture, all aspects are complete in the station, only that situation will lead you to pass that particular station, right? It's not only that you will do a very good communication, you are a very soft spoken, and you build a very good rapport with the patient and you pass the station. It's not like this, right? It involves preparation in many aspects, like your applied clinical knowledge should be very well versed so that you can apply it at the spot. And even in some time, in some circuits, you know that there are 4 to 5 unseen stations as well. So, you know, when there is an unseen station, your all preparation, your all recalls, they cannot help you at all. Then at that point in time, only you are there with your communication skills, with your knowledge to apply it on that particular patient, and you have to pass the exam, right? So, first of all, the agenda of the session today is that I'm here with new recalls. These are the recalls which were in the November exam, right? And along with those recalls, as I'm not knowing the basic and how much you people are prepared, how are you, my dear Rekha? Thank you so much for joining, Rajini. Rajini, screen is visible.
No,
No, ma'am,
ma'am,
I can
nothing is
now
visible.
now I can see. Now I can see.
Okay,
Yes.
all right. So, you know, the agenda of today's session, as I have already told you, that I'm not aware that how far you people are in your preparation, right? So what I am going to do is that I will allow you guys to present few stations, and then I will cover this whole station from head to toe in such a manner that nothing will be left incomplete in that particular station. And after the end of this session, those stations will be completely prepared, right? Not a single point will be left on those particular stations that I will do today with you guys, right? As I have already told you. So first of all, before starting the first station, what I want to share with you, friends, is this, that if you people believe, and if your seniors or if any people who has cleared the exam and she's telling you that just doing very good in communication make you pass the exam, it's not right at all, right? You have to cover the station in all aspects. Take, like, just imagine that you're sitting in a clinic and some patient visits to you, and you're very soft spoken and you talk to him in a very polite manner and your rapport building is very good. It doesn't mean that patient will become fine, right? Patient is here with some agenda. Patient is here in the stations with something to explore from you, that how far you are in your knowledge, right? So all this combination will make you pass in that particular station. So do not take it easy, do not take it lightly that yes, we will do a very good rapport building and we will do very good communication and we will pass the exam. It's not like this. Communication with patient is only one single domain. The main domain, actually there are many domains, like communication with patient, communication with colleagues, and your applied clinical knowledge. But the most important domain that will lead you to pass the exam is a patient safety, right? Do not forget about it, that patient safety is the only domain which will lead you, which can make you pass this exam. Doesn't matter how good you are in communication with patient, doesn't matter how good you are in communication with colleagues, how better and how best you are in your applied clinical knowledge, but until and unless you will pass the patient safety, you will not able to clear this exam, right? So in every station, you should be knowing those 2, 3, 4, or 5 points which are included in patient safety. If you are taking, like in the part 2, the thing that can make you pass or fail is your source of the study, right? In part 3, the thing that matters is that from where you're getting the guidance. If your guidance is appropriate, you can go this exam and you can pass this exam in a one go. If you have not taken the right guidance and you're on the wrong track, mark my words that it will be very difficult to pass the exam. Because you know how the circuits are conducted in the exam. On the exam day, there are 14 stations, everybody probably knowing about it, right? There will be 14 stations, and on these 14 stations, there will be 2 minutes reading time, and then 10 minutes will be a performing time, right? And usually 3 circuits almost running in one time, in the morning and 3 in the evening, right? And you will be given circuit number A, B, or C. And then on your email address, you will receive the station number as well, that at what particular station you will stand. The distance between one station and the other station is only 4 to 5 steps only, right? They're very close to each other. Even you can hear the voice of your companion, your other students as well. They're very close to each other, so there is no point that there will be wastage of the time in between the stations, right? No wastage of the time will be there. But what you have to do is that while you are doing your preparation, first of all, remember 2 important things before we take the first station and before we take the first candidate. The most important thing is that at every station, at the end of your preparation, you should be knowing that what are the passing points, which points, if I miss that, can make me fail. If your mentors, if your study partners are unable to discuss with you that which are the failing points, which are the patient safety passing points, it means you are wasting your time. It means you are doing those stations uselessly. No benefit of doing any station if you are not knowing that what particular question the role player is going to ask me. Their questions are fixed, right? They have fixed question for every station. If you're not knowing those questions and you're appearing in exam, it's a huge risk, right? Before reaching in the exam center, you should be knowing exact question that you're expecting that the role player will ask you. You should be knowing the patient safety points that in particular station. These 2 things will make you pass this exam. Because passing rate and the passing score is still very less. In each circuit, only 1 or 2 students are able to pass this exam, right? So can you imagine how tough is that? Everybody is doing preparation for many months. Everybody is revising those stations for many months. But where they are lacking is that they're lacking in that particular point, that they're not focusing on one single domain, that is patient safety. You cannot pass this exam without passing the patient safety. No matter how far you are good in communication or everything, you have to pass the patient safety in each station. You know, only in that case you will be able to pass this exam. And I have not seen the students on emphasizing on this particular point. And the second thing is that you should be knowing the question that you are expecting that role player will ask me, right? You should be prepared with those particular questions. Otherwise, there is no benefit of doing 6 stations in one day, doing 10 stations in one day, or revising even 12 stations in one day. If you are doing 5, 6 stations in one day, but you are knowing that what I'm preparing and what the role player is expected to ask me, only then it will be a useful study. So please, please choose your guidance very wisely. Choose your study partners very wisely. Only in that case, it will be easy for your exam. I'm sorry if it is too much information for you. Yes, Anam, probably it's being recorded, right? But don't worry. I will be actually the number of stations that we will discuss today. If somebody will feel that she's unable to present today or he's unable to present today, don't worry. We will again come back with many discussion sessions, and they can present at later point in time as well, right? But the thing that I'm emphasizing is that so that you people will be knowing that where you have to put the focus on every station. When you're revising station with your study partner, give pencil and copy in his hand and tell him that he has to write the points of patient safety, make a big circle around them, right? When you will be standing around outside the cubicle, you should be knowing that in this particular station, I will cover these patient safety points. Now, the second most important tip is this that nobody will tell you, right? Second most important tip is this. In every station, there are many, many points, but some points you need to cover in first 2 minutes, right? You should be knowing that these are the important points that I need to cover in first 2 to 3 minutes, because otherwise role play will start asking questions and you will just have diversion of your mind and you'll just have flight of ideas and you will just flow with the flow and you will forget about those important points. So you should be, it will be very strict in your mind that I have to speak these sentences, right? These are in my mind. These are in first 2 or 3 minutes. I will make the examiner go tick, tick, tick in my patient safety so that my station will go past, no matter if I miss any question of the role player, right? So I will discuss further detail in the next, the stations that we will discuss. And I can see Shaista is with us, Tanzeen is with us, Swathisri is with us, Ranveet, Kaur, Purnima. Okay, so who will be the first presenter? Because I think so that I have a lot of information to discuss with you, friends. I will share all the discussion, all the information bit by bit. But let's start that who want to present first.
Ma'am, may I do?
May I know who is this side?
Rekha.
All right, Rekha, just a minute. Who is going to start the timer? Deepika, can you start?
Okay, ma'am.
Deepika, you will start timer for 2 minutes, right? And then we will start, 2 minutes will be the reading time. And
The station is not in front of me.
yeah, just a minute. I have not shown the station, just a minute. But Rekha, you can take as much time as much you can take because I just want to know your potential. I just want to see that how far you are in your preparation. And don't worry at all. This is just a discussion like your study buddies, right? There's no mentor, there is no students. We all are friends and we are discussing the stations, right? So don't worry about any, because I want those students who have never presented the station, they should also come forward, right? This is the time to just break all the barriers that you are having. Because apart from breaking those barriers, still we have a lot of things to do. So it's better to take steps and move forward. Okay, let's start. So Deepika, you are starting the time, right?
Ready? 1, 2, 3.
Just a minute.
Start.
Yeah, start.
Please
mute your mics.
जब सरकार नीति आने लगा तो देखिए डीसी रेट में अच्छा डीसी रेट में शक कम होता है
Can you mute the mics, please?
Yes, just a minute.
मतलब
किसको कह रहा हूँ मेरा फोन कहाँ चला गया
क्या हो गया
Okay, ma'am.
Yes, please.
Time is not up.
आप इधर जाके करेंगे सेशन
Time up.
Okay, start.
Hello, I'm Dr. Rekha in the clinic. May I confirm your name and age, please?
Yeah, doctor, I am Mrs. Robert.
Your age, please?
Yeah, I'm 28 years.
How may I call you?
Yeah, you can call me Jennifer.
Okay. Jennifer, please accept my apology. My consultant is not here. Can I continue the consultation on his behalf?
Yes, doctor, but you know that my problem is very severe. I don't know that whether you will be able to handle this situation or not.
I have gone through your records. I will arrange the next appointment with my consultant as soon as possible. Is it okay?
All right, if you're capable enough.
Okay. I understand from your notes that you are having the waterworks problem and you delivered 2 weeks back. Is that right?
Yes, exactly.
Any other concerns and expectation?
Yeah, I'm very, very upset because of my situation. I'm having still this tubing with me. So I'm quite upset. I want to know the solution that what your people are going to do with me now.
I'm really sorry that you are going through such a hard time. We as a team are here to help and support you. Do you mind to know your situation better? Can I gather a few details?
Yeah, sure.
Can you tell me more about your problem?
Doctor, actually, it's been almost 2 weeks that I delivered a baby, right? But after that,
Mm-hmm.
I was in so much trouble that after the delivery, I was having some difficulty in passing pee, and they have inserted some tubing inside me, and they told me that I will become all right. But
Mm-hmm.
problem is persistent even after the 2 weeks. I don't know that what's
Mm-hmm.
going to happen with me right now.
I'm really sorry for that you have gone through such a hard time. So, do you feel any sensation to pass the urine?
Yeah, it's almost sometimes.
Mm-hmm. Is the stream is normal?
No, it's very bad stream.
Mm-hmm. Okay. And do you feel empty at end?
No, not much.
Any leak?
Yes, sometimes there is. I feel sometimes there's a leak.
Okay. Is somebody is supporting you?
Support at home, it's fine, doctor.
Mm-hmm. How's your baby is doing?
Baby is well, but I'm so upset that I'm unable to enjoy this particular time that I was waiting for so long.
I can see it. It must be a very hard time for you. Help is available. So, may I know that apart from this, do you feel any difficulty in passing the urine?
Doctor, I am having this tubing, and they have told me that after 2 weeks the tubing will be out, but still I am feeling the same difficulty.
Okay, that's okay. So, may any burning or any blood in the urine?
No, not at all.
This is the first time you are having this issue?
Yeah, before this delivery, I was not having any problem at all.
Any issues with bowel?
No, not at all.
Any pain in the tummy?
No.
Any bleeding?
Bleeding is fine. It's mild.
Can I ask some personal question?
Sure.
Have you resumed the sex?
No.
Any plans for the contraception?
Yeah, I have discussed with my GP already.
That's good. Okay, can you tell me about your delivery events?
Yeah, delivery was actually it was a long labor, and at the end they told me that they have to use some metallic instruments to take the baby out. So it
Mm-hmm.
was it was not a very pleasant experience at that time.
I'm really sorry that the care you received did not meet your expectation. Can I review your records for more details?
Yes, sure, you can.
Okay. Have you received epidural at that time?
What is meant by epidural?
Back needle?
The
Pain relief.
injection in the back. Yeah. Injection in the back was given because I was needing that delivery with the metallic spoons. These are called forceps, right?
Yes, you're right. Do you remember the weight of the baby?
Baby was good size. It's almost 3.8 kg.
It was your spontaneous labor or any medications were given?
No, it was spontaneous.
And how was your pregnancy otherwise?
Yeah, it was fine.
Okay. And any health issues like diabetes for which you're following your GP?
No, no issue.
Okay. Any allergies that you are aware of?
No.
Do you smoke?
No.
Okay. Are you aware of your weight to height ratio?
Yeah, it's fine. It's 25.
Okay. Thank you so much for giving me all this information. Anything else important you want to add?
Yes, I want to add that when I was having just difficulty in passing pee at that time, they have passed the plastic tubing inside my water pipe, and they told me that it will be fine after 24 hours. They sent me back home. When I came back from the home after 24 hours, even my problem was persistent. And then they told me that they have to pass this tubing inside the water pipe for 2 weeks. And I'm back after 2 weeks, and still the problem is same. I don't know that what's going to happen with me now after 2 weeks.
I'm here to explain you, Jennifer. Actually, what happened after the delivery, it is quite common to have some problems with um, having the problems with passing the urine. You are not alone in this phase. 25 out of the 100 women may experience this because at the time of the delivery, what happened when the baby is delivering, it can stretch the muscles of the pelvic floor and can cause weakness and loss of the bladder tone, and because of the hormonal changes. So these problems can happen, but we have the solution. Don't worry.
So
Okay.
what you're going to do with me now?
So what we will do, first of all, we need to take the sample of the urine to rule out any infection. Okay, if there is any infection, we will give you antibiotic. I will also inform the consultant as well regarding this, and I will give you also a patient information leaflet and also writing back to your GP about our agreed plan. So our plan will be, I will put you in touch with a physiotherapist. Okay, they will discuss with you some exercises that will help to improve the tone of the muscles and the bladder retraining. That means that how to train the bladder. Okay, this will be guided by my specialist nurse as well. Am I clear till that point?
Okay, but doctor, can you tell me that why I'm the one who is having this problem? I don't know. Like my sister has delivered, my friends have delivered. No one has faced this problem. They all probably having the same kind of situation that you are telling me, that when baby
Time
passes
up.
through the birth canal, there is some difficulty over there. But why I'm the one who is having this problem?
I can see certain factors in your situation having the first baby and when the instruments were used. It could be the some of the factors which can increase the risk, but we don't know about the circumstances of your sister and your other
Time
friends.
up.
But it means that there was some problem in my delivery, right? It means they were not experienced one.
At this point, I'm unable to give you the answer that why they didn't do this. So, of course, we will going to look into this matter. We are going to write an incident report that why this was happened to you, and once the report come back, we will be open, honest, and transparent with you.
Okay, after this test, then what will be the plan?
Yes, so first of all, we need to pass the catheter, that is the tube, into the water pipe that brings the urine out to see that how much the fluid is left in the bladder, that is water bag. And according to that, we will decide that how we will going to do. If in case it is more than 700, I'm sorry to tell you, we need to keep the catheter for the 2 weeks, because if we don't treat this condition, it will
It's
going to
already
lead.
2 weeks. So you will keep the tubing further 2 weeks, right?
It will depend upon the volume. If in case it is less than 250, then we will encourage you to pass the urine. But if in case it is between the 250 to 700, then we will pass only for the 20 hours. So it will depend on that.
All right. And does this condition will have some effects in my rest of the life?
Most of the women recover quickly, but more the volume remains in the water bag, so more the chances of having this persistent problems. But after that, if in case after the 2 weeks still the problem is ongoing, we will discuss with you some how to temporarily empty the bladder and discard the tube, that is clean intermittent catheterization.
Okay, so 2 weeks have already passed, and you will keep this tube again for 2 weeks, and then I will shift on to that process, right?
Yes, because it will all depend upon that. And because it is very, Jennifer, important to treat this condition, otherwise it will lead to the recurrent water infection, and you can have the problems with passing the urine, and can lead to the affects the kidney as well.
Okay, all right. It's okay.
Okay, Mrs. Jennifer, do you have any questions?
No, it's fine then.
Okay, Jennifer. So today I will arrange this test as well. I will inform my consultant, and also we will involve the urogynecologist who are specialized in dealing this of types of the situation. And I will also give you the. I will connect you to the counselors and support group to that will help you to cope up with the situation.
Okay, all right.
Okay. I will document my consultation, and I will, if at any time you are feeling fever and feeling unwell, you are not coping with the situation, I will give you the contact details as well.
All right.
Thank you.
Thank you. Thank you so much. Thank you, Rekha. Thank you so much. It was
Actually,
wonderful.
you are a very angry person.
No, I was not angry. But if somebody was in this situation, she must be very, very angry, right? I tried myself.
No, ma'am, it's good because we need to do. I don't know how I perform, but I don't know.
You performed very well. Really, really, you performed very well. But the thing is this, you performed really very well. It's not like this that we are conducting a session. This is the reason that I am saying you. But really, you have touched very, very good, important points that I will discuss in detail this station, right? You touched very important points, right? But the thing is this, why I am here with you, friends, is this. I will tell you the most important trick. Trick is this, that the passing marks, the marks that will make you pass, you will cover in the first 2 to 3 minutes, right? Because many important points you discussed when the time has already done, right? In the scenario, in the real exam situation, you will not be left any option if the time will over, right? So time management is really very important. So starting this station, Rekha, what I have observed is that your communication is definitely, no doubt in that, is very good. You have covered all the VESI questions, right? Your apology was very good. VESI questions were almost covered. Postpartum questions were covered, right? And delivery plans you have covered. But Mark, please, everyone, open your copies, notebooks, whatever you want to open, right? And write the points that I am mentioning. The most important point in the information gathering that you have missed is this, that what was the discharge criteria? When you were discharged from the hospital after the delivery, whether the discharge criteria was fulfilled or not. And you know that is the passing and the failing point in this station. If you are not knowing the failing and passing point in the station, in spite of doing very, very well, extremely well, you can miss the station, right? You have covered all the important points in the management, like sending midstream urine, intermittent catheterization, right? Physiotherapy, antibiotics. You have covered many points, many important points, right? Teen intermittent catheterization, every time, even long-term complications as well. But I will tell you in this particular session that how we will take the station in this manner, that some people cover the station in 10 lines and they pass the station. Some people will cover the station in 100 lines in 15 minutes and they're still unable to pass the station, right? So where actually this trick is, we will cover today that particular trick, that in minimum time with minimum lines, you will pass the station, right? Some students are speaking a lot of sentences, but they're missing the important things. So we will know, you know, that this is a recall station and it is coming so frequently in every exam, right? Please, friend, mute your mic so that recording will be very smooth, right? Please write in the chat box whose mic is unmute so that I can start the station. Mute. Everyone is mute, I think so now. All right. Now let's start the station with me. You have touched the very important patient safety point, which is telling the patient long-term complications. Excellent, Rekha, that you have passed the patient safety, right? Patient safety points in this particular station make a red circle around them, telling the patient safety criteria of the discharge is the safety point, and that is the passing and the failing point in this station. Telling the patient about the long-term complications, this is the patient safety point. It can make a difference between the passing and the failing station, right? This is the safety criteria that whether the patient will pass, whether the candidate will pass or not. So starting the station from the very beginning, first of all, we will start the introduction, right? That I am Dr. this. I am sitting in the gynecology clinic, or I am sitting in the postnatal clinic, wherever you are sitting, right? And how are you doing this morning? How may I confirm your name and age, please? What are your expectations from this particular consultation? Then we will set the agenda. In the agenda, actually, before appearing in the exam, when you are practicing with your study buddy, always you should have sections in your mind. When you will make sections in your mind and you will follow those sections while performing the stations, mark my words that exactly in the exam situation, you will follow those scenarios, you will follow those sections in the exam as well. But in between, the role player will come out of blue with some amazing question that can make all of your flow here and there, right? So what you have to do is that you will cover all the passing points in this first half, in the first 3 minutes of your station, so that when the role player will ask the questions, your points will not go here and there, your points will not miss, right? So always in every station, mark 2 to 3 points that whether the situation will go this way or whether the situation will go that way, I will cover these 2 to 3 points in the station, right? And I will cover in these first 2 to 3 minutes, right? What are your expectations from this particular consultation? And it's a very good thing, Rekha, that you have acknowledged the concerns of the patient and you have shown sympathy that you know that if patient is passing this situation, that she's having tubing and she's going back to home after 24 hours and then after 2 weeks, this is definitely a difficult time for her. So definitely we have to acknowledge that I can understand, Jennifer, that you are passing through difficult time. It must be very hard for you coping with a newborn, passing through the immediate postpartum period and then having this additional issue can make your life very difficult. I can understand this is a very difficult time for you. But don't worry, we will make it easy. We are here to help you and support you in this. Me and my team are here with you, right? We will not leave you like this. We will help and we will address all of your issues. Make her feel comfortable. Make her feel like you are all here to help her, right? This is more like... not like in your clinic when you are sitting with a blank face. You should be very expressive with your thoughts, with your emotions, with your body language, with your hands, with your expressions. You should be very sympathetic and you should be very expressive at that point in time, right? It will even help the patient in rapport building. It will help patient in developing trust on you that yes, my doctor is understanding my concern and she's so much concerned about my difficult time, right? Because this is a difficult situation that patient is passing. So do 100% reassurance. Be very, very expressive and start practicing these type of actings with your role players, with your friends, right? So that you will be very perfect at that point in time. So Rekha, although this is an exam, this is not real patients, but we should practice in this manner that it will be looking like you are very sympathetic and you are really feeling that what she's going through, right? Never let the patient to think that you are thinking that she's exaggerating her problems, not like this. After that, when we will set the agenda, we will say that, Jennifer, in this consultation, I will address all of your concerns, right? I will give you all the management plan so that we can address this issue immediately. Along with that, to help you in understanding, I will give you patient information leaflet. If you will feel that there is something which is not understandable to it, you can write on its back as well. Then we will document all the discussion in your notes. I will write back to your GP as well about your condition, right? Is it okay with you? Okay, so Jennifer, I know that you're passing through difficult time, but to help in this situation, I need to ask few questions. So if you allow, can I proceed? Right? And then you will proceed. In any information gathering, that many students are passing in the domain of information gathering as well, because they are not knowing that what is the purpose of information gathering. Purpose is that to rule out the risk factor that any patient is having. Second purpose is that immediate symptom that need immediate attention, right? Because when the patient, immediately after the information gathering, when you will explain the situation to the patient, her first question will be, why I'm the one who is having this situation? Why other people are not having this? It means she's asking you and they are checking that whether you're knowing the risk factors or not. So you have to rule out the risk factor. And this is a scenario for any station. Rule out risk factors and rule out the symptoms or the consequences, right? May I know more about your concerns? Immediately acknowledge her concern, provide her full support, right? Since how long this problem is going on? Then start the VESI questions, right? VESI questions mean, what about the volume of the urine that you have passed? Are you having any sensation, right? These are the VESI questions. Just a minute. These are the VESI questions. Jennifer, did you pass good volume of urine? Did you feel that your bladder is empty at the end? Do you have sensations that you have to pass the urine? Was your stream was normal? Was there any incontinence? And I can see that Rekha has covered all the basic questions. Any one single question, if it is not covered, it doesn't make you fail, right? But still, you should try your best to cover all the questions in the exam, right? After the basic question, then definitely this is the postpartum patient. She has just delivered 2 weeks before. So you will ask from her that how you are coping with this situation and the new baby, how the life is going in this difficult time, how you're coping with that. Then she will come up that it is very difficult with a young baby to cope with all the situation, right? Then you will feel if there is any bleeding, if there is any pain, any breastfeeding. Yes, Purnima, patient is catheterized, my dear, but basic questions we need to ask, because along with the catheter, she can have sensations, she can some dribbling, she can have burning, right? She can have all these sensations. Then postpartum questions, she's in the postpartum period. Then experience of the labor, was any pain relief? And immediately in the speedy manner, you will ask these questions one by one. When you were in labor, because you know that during the labor, it is very important that her bladder should be emptied every 3 hours, right? It is very important that if she was catheterized in the labor or not. Was there any tubing was passed at the time of labor? Was the tube removed when your instrumental delivery was about to be taken, right? Did you empty bladder regularly, frequently? Whether this tubing was taken out at the time of delivery or not, right? Because it is very important to empty bladder every 3 hourly, and it is also very important to take the tube out at the time of the delivery, right? So these few things you need to confirm from the patient during the history. Because Ravneet, actually, you know that she has been given trials. When she get back to the hospital after 24 hours, she was given a trial. When she was, her catheter was removed in this visit, even at that time, she was given a trial. So during the trial period, she was feeling if she had felt okay, then she was not recatheterized. The reason that she is being recatheterized after 24 hours and even after 2 weeks is that she was having all these problems, right? This is the reason that she's being catheterized again and again. Just let me complete this whole scenario, then you will have a good idea about it. This is my exam question, right? I was the one who have performed this station. So I will tell you exactly that what role player has asked me and what was the exact answer of those questions, right? Rekha, you were saying me that you will catheterize, you will assess the residual urine, and then according to the amount of the urine, you will decide my management plan. My
Yes,
role player has told me that everything has done already. 24 hours have already been done, 2 weeks have already been done, and she is not ready for any trial further. She's asking the management after 2 weeks. The management will start at the end of the flow chart. We cannot go back again towards the flow chart, right? I will let you just wait for a few minutes. I will tell you that how we will handle that situation.
So, ma'am, maybe neurogenic cause is there.
Yeah. Just a minute. We will discuss the causes, but let me complete the information gathering, because I want people to be perfect in every domain. Even many students are failing the information gathering domain. Do not take it lightly. In the information gathering domain, you have to cover immediate problem like urinary symptom. You have to cover the postnatal questions. You have to cover the problem of the labor. But you were asking me how was the pregnancy. It is not very important until and unless you ask that whether you are having any urinary problem before pregnancy or during the pregnancy, right? Only that is important. After the information gathering, then you will cover the medical history, social history, and how are you feeling in the last few months or in the last few weeks. Mental history is very important, right? Because in the immediate postnatal period, when patient is already having a condition, when her quality of life is already suffering, you cannot ignore the mental history, right? Mental history, BMI, allergies.
Already saying that I'm not enjoying the motherhood because of this condition. So it means that she's already telling her feelings.
Yes, but we have to cover the information gathering. You have to speak the question, right?
Okay,
No matter
we
what
have
the role
to see.
player is saying. Yes. Information gathering is such an easy domain to pass and such an easy domain to fail. If you will not give it an importance that it deserves, anyone can fail in information gathering. You should be knowing that what basic big chunks I have to cover. The first big chunk is about the urinary question. UTI, you have to rule out burning. Blood is not that much important because she's not having any tumor. She's not having probably any stones, right? So the presence of blood in the urine is not very important in the immediate postpartum period. But other questions that you asked were very important, and you have to cover that. You have to cover the postnatal mental history and the process of the labor. And secondly, after the now explanation of the situation. Explanation of the situation is very important when patient will finish. This is the sequence of the discussion that you will do with the patient in every scenario, in every situation. First of all, introduction, rapport building, exploring her concerns, agenda making. Next step will the information gathering. The next step will be explanation of the situation. Jennifer or Emily or whatever her name is. See, Jennifer, I can understand that you are passing through difficult time. Sometime it happened that patient after the delivery, because baby passes through the birth canal, it stretches the walls, it stretches the water pipe as well. So sometime if patient is having some other risk factors as well, they can have these problems after the delivery. And we call this condition as postpartum urinary retention. We call this at postpartum voiding problems, whatever. You have to tell the diagnosis to the patient. Rekha, you have not discussed the diagnosis to me.
Ma'am,
Right?
I mentioned postpartum voiding dysfunction. I mentioned.
Okay, good. Okay, great. If you have mentioned, it is very important that because we are doctors, we are not like any layman that we are just explaining in some other ways. Whatever the language you're using for explanation, but the name of diagnosis you should mention, right? Because across the table examiner is sitting and in front of you the role player is sitting, right? So you will tell her that we call this condition is a postpartum condition, postpartum urinary retention. Immediately she will say that why I am the one who is having this situation. Then you will say that there can be some risk factors which can lead to this situation in some women, like patients who are delivering for very first time, if there is some cut down below, if they're having prolonged labor, if they are having delivery through the instruments, all these factors, all these factors can increase the risk of this situation, right? But we are here to help you, and we will involve our senior consultants in your management. We will send your urine sample to see if there is any sort of infection so that we can start certain antibiotics to you to reduce the risk of infections. MDT, you will say that we will involve a team of specialists in your management. Rekha, what I understand is that somewhere you have mentioned some red flags as well, right? If I'm not wrong, you have mentioned
in the last.
In the last, yes. This is the point that I need to emphasize. You will not mention red flag in any scenario at the end, because even in this question, if the red flag is maybe the passing or not the passing marks, but there are many, I'm coming with the next few stations in which the red flag will be the passing marks of the station. So this is the point when you will cover the red flags, right? Many patients can have this situation. We will help you with the team of specialists. But let me tell you, Jennifer, that even after the management will be completed and you will go back to home, if you develop this, please come back to us. Please make a call to your immediate early assessment unit or your gynecology unit or whatever the unit is this. Please call back. Please come back to us. This is the point to cover the red flag sign. This is the reason that I'm emphasizing that don't leave the passing marks at the very end point. Cover all the passing marks in the very beginning, right? Because if you will miss 1 or 2 points in the management plan, you are not going to fail the exam. You're not going to fail the station, right? All the students are putting so much emphasis in the management plan, no doubt in that management plan is more important, most important. But still, there are certain points which can make you pass or fail the station. Telling the red flag, because patient is a layman, she's not knowing that these are the red flag and I have to get back to the hospital. If we will not tell the red flag to the patient, like if the patient was having any sort of abruption or any other condition and she will get back to home, she's having mild bleeding, she's having decreased fetal movements, and we have not told her that yet you have to come back if your movements are less, we have committed a crime, right? We were the right person to tell her that these are the red flags and we have not told her. So they will never forgive you. They will fail the station if you will forget to tell the red
Dr. Asma, after the MDT, we will mention the red flag sign.
You can mention over here, like in the
Where we are mentioning the risk factors, ma'am?
Yeah, because you're having this
Okay.
situation, we will complete your management with the help of team of
Mhm.
specialists. But
Mhm.
listen, Jennifer, if you will develop only two words, 3 words, if you will
Mhm.
develop burning, bleeding, this, you should come back immediately. That's
Okay, I get
complete
your point.
red flag
Mhm.
done. Right? Do not waste so much time at every point, because you have to take, even you do not need to cover all the points. Always mention only 2 to 3 points. These are enough for everything, like for risk factors of the any condition, like for side effects of the medication, like for effects on the mother
2
and
to
the
3
fetus, like
days.
you're covering antenatal and maternal medicine. Do not waste a lot of time, but touch every point. I have seen students who are covering incident report in 4 minutes. We will initiate incident report, we will collect the risk management team, they will collect all the information, then they will call you, then they will tell you. No need to mention all the things. You have spoken the incident report, your marks are done. Now move immediately to the next. Part 3 exam is like mathematics, right? They are ticking your points. If you will spend so much time in one point, you are wasting your hell of time, and your marks for the next few points are going to miss. So in very, very good speed, cover every point. Okay, then we will discuss, then we will do an ultrasound scan of your bladder to see how much urine is inside, and then we will make the decision according to that. Our consultant will be involved, and we will discuss with a specialist doctor who are expert in that. We are called urologist. They will decide if you need any special testing. These are the storage and voiding testing. These are called urodynamics. They will decide about it, that whether they need it or not. The next step is that our continent nurse will explain you that how important is this to keep the bladder empty. If you will not keep the bladder empty, the tone of your bladder will become lost, and you will have some long-term problems. This is the reason that we will tell you, and we will explain you the procedure, that you have to empty your bladder at the frequent intervals to keep the bladder empty until and unless we will have restore the tone of the bladder. Right? Until that time, I'm sorry to tell you, Jennifer, that you have to do this process. And continent nurse will explain you all the process, right? Then she will ask that there was some problem in the delivery. Then you will say that I will review your case notes. I will discuss with my colleagues. If I will found that there is a lack of care at any point, then definitely we will initiate an incident report. And there is a safety criteria for the discharge. And for your surprise, my students, my friends, for your surprise, this is the passing marks in this scenario. If you will not, what is the safety criteria for discharge? Anyone can tell me if you have gone through that particular talk.
So, voiding volume should be 200 to 250, and she should pass the urine level after the 6 hours after the delivery.
Yes. This is actually, we will say that Jennifer, actually, we discharged the patient when they met the safety criteria. When they pass the urine within 6 hours, and from your history, my patient has told me that she has passed urine after 8 hours, right? And urine was also less. So in your situation, you have passed urine after 8 hours, and the urine was also less. So I will review the case note that why you were discharged at the earliest, right? So we will initiate an incident report. After that, you will tell that if it will be, we will not take care of this, this condition can have long-term implications. It is important so that she cannot take the clean intermittent catheterization very lightly. She should be knowing that this is very important thing, and then she will follow the protocols that you will advise her. So
Dr. Asma, so already she was 2 weeks catheterized, so we need to catheterize for another 2 weeks, or directly we will start the clean intermittent catheterization?
Just a minute, let me tell you. I will show you the flow chart, that what it says actually. If you can go this point, patient to go home with catheter for more than or equal to 2 weeks, right?
Yes.
What
Yes.
I did in my exam is that, and what you can do, there are two type of stations can come. One is that the 2 weeks have completed, right?
Okay.
The
Okay.
scenario is that 1 week has completed. In both the scenario, because it's equal to or more than 2 weeks, you can give a time that we can give you a time of 1 week more. And then we can shift you on, if the situation is not settled, then we can shift you on the clean intermittent self-catheterization. But it is very important to mention that point. And you know that my station went so well that role player has shown me thumbs up at that time. Because this is a station, this is a new recall. It's coming in last 1 or 2 exams, right? And everybody is knowing about this chart. When I started telling about this story, my patient told me that, doctor, this has been done. This has been done. I don't want discussion about it. I am at this point now. Now start my management from this point, right? my study partner with whom I was preparing actually, she has already told me that these situations have already done with the patient. So no marks of mentioning all these situations. Patient is already at the end of the flow chart. No points of getting back.
So Dr. Asma, we will keep the catheter for another one. Directly, we will
Yes.
teach her because already 2 weeks has passed. So we teach her
Yes.
directly clean intermittent catheterization.
Both you can mention that. See, you can mention both the things. We can, Jennifer, we can keep the catheter of 1 week as well, or along with that, we can teach you that you have to empty your bladder at the frequent intervals, right? And the continent nurse will teach you in that. And our consultant is here. I will discuss your case with my consultant as well, so that we can discuss your case, right? Both the things you can explain to the
Both
patient.
we can do simultaneously.
Yes. Simultaneously, because you will not leave a single sorry where I'm
Ma'am,
going.
but if we keep the catheter for so how we will teach her the clean intermittent catheterization for, because the clean intermittent catheterization is a temporary solution, na? Like we teach her that
It's not temporary. It's actually the management plan of this patient, because definitely there is some neurological cause, right? She will become fine after some time. She is going to find she will not stay like this for lifelong. This is the treatment of this condition. Clean intermittent catheterization is recommended treatment for this condition. Neurodynamics will be done to rule out any other cause related with this. Anesthesia evaluation, neurologist evaluation will also be done to rule out if there is any neurological cause, if there is any psychological causes underlying, right? These managements will also be done, but she's not going to stay for the lifelong. This situation is going to settle in next 1 or 2 weeks, but we have to tell all the options: ultrasound scan, urine culture, antibiotics, MDT, ultrasound scan, urodynamics, clean intermittent self-catheterization. You will touch all these points. Along with that, you will never forget safety criteria, red flag signs, and along with that, long-term effects. If you will miss that, these are the failing points of the station. These are not the failing point of the station if you will miss one point or the second point. These are 1, 2, 3, 4, 5, 6, 7 points in the management. If in the 7 points of the management you miss 1 or 2, you are not going to fail, right? But other points that I am telling you, if you
I got your point that the long term and the safe.
Just a minute. Sorry, Rekha, I mute you just a minute. Rekha, can you unmute yourself?
Yeah, it's okay, ma'am. Fine. I got your point.
So this is actually the gist of the station. This is actually the purpose of discussion right now, is this, that you should be knowing in every station that what are the passing points that at any cost I have to speak in front of the role player, right? And the rest she will guide you further. And these are the questions that role player have asked from me. These are, and this will be, and you know that these are the recall stations. If the same station will come to you in the exam, and the examiner was holding piece of paper along with their laptops, because definitely they are making their keys. They were just shuffling the papers and they were picking the marks that yes, I have spoken this, I have spoken this, I have spoken this. So these are all the points that you have to cover in this particular station. And then you will say that I will take another appointment from at the end, please speak this line as well. I will document all the discussion that we have done in the notes, right? I will initiate an incident report. Please accept my apologies that you are passing through this situation. Is there any other concern that you want me to address for you? Because at this point, is there any other concern that you want me to address for you? At this point, if you have missed us any point, any question, the role player will again come with the next question. So after every point, ask, is there any other concern that you want me to address for you? Is there any other concern that you want me to address for you? Because definitely she has been given 3 or 4 questions. If you will not give her an opportunity, she will not ask. Then you will say that I will take an appointment from my consultant. This is a patient information leaflet. If you feel that anything you're feeling difficult to understand, you can write on its back and we can discuss in the next consultation. I will write back to your GP as well. I will connect you with a continent nurse as well. So this is so how is the station now?
Yeah, I realize that some of the points missing in my station. Yeah.
Not some of the points. Rekha, my dear, listen. The points which can make you pass and points which can make you
Yes,
fail.
ma'am.
These are the
Yeah, I
important.
understand. Yes,
Do
ma'am.
not
Yes.
emphasize that you have to memorize all these 10 points. No need to mention all the 10 points, right?
Mm-hmm.
Like in antenatal module and antenatal care in maternal medicine, students are memorizing 10, 15 effects on mother, 10, 15 effects on the baby. No need to mention those. It will score only 1 point in the scorecard, right? Immediately in the station, try to cover every point in the discussion, right?
Okay, ma'am. Okay, ma'am. Thank you. Yeah,
So
thank you.
everyone is clear about the station now. Please tell me in the chat box that how was this station now?
Ma'am, one question I had, because like maybe in between I just means I had some internet issues, maybe I've repeated, so I would just, can I ask you?
Thank you.
Maybe
Yeah, Chitra. Thank you, Rekha. Yeah, please.
So ma'am, she has come at 2 weeks, okay, with the problem still continuing. So can't we tell, okay, we will, I can tell her the implications of this, like the long-term effects. And as of now, because already 2 weeks has passed, so MDT will take care, including whatever you have mentioned. She can give her sample, the physiotherapy, and the MDT would do some special test to know what is the cause. And then the treatment can be given accordingly. Can't I tell like this, or I should be telling that you would be kept on catheterization and intermittent, like that is the question I'm having.
Actually, these are not the stepwise management. We are going everything simultaneously, right? Because we are not doing all these things in a stepwise manner. We will do everything. We will do her urine culture. We will do her ultrasound scan.
No, ma'am, we have done that. But now she has come at 2 weeks with the catheter still, and her problems are not sorted out. So now, as of now, 2 weeks has passed. So, according to my understanding, now the MDT team would take care of her, including the neurologist. Urologist would do some special scans or maybe urodynamic, and then decide the further course of action.
No, absolutely. Actually, this is not the situation. They are not the one who will decide the management. She is here with us. We cannot say that we don't know about your management. We are referring you to the MDT. Go there and they will decide about you. No, it's not like this. We have to satisfy the patient, right? We are sitting in the clinic to help her. We have to figure out.
No, ma'am, that is correct. But whatever means based, I can tell that whatever, like based on the urodynamic, because now she's at
Yes,
a point where the special.
The purpose of, exactly. The purpose of urodynamics is that if there is some other cause is found, then definitely these will be the experts who will treat you, right?
Okay, and if no other cause is found,
Yeah, definitely. Intermittent self-catheterization is the solution of that. If this is just a postpartum issue, it's just a neurological issue, then it will be settled after some weeks with the help of intermittent self-catheterization. But you cannot skip intermittent self-catheterization, right?
Okay, so ma'am, so now she has come at 2 weeks with the catheter. So now what advice am I giving her? Okay, nothing has come out in the special test. So what is the management? Means after sending all those samples and samples of urine and physiotherapy.
Intermittent catheterization, my dear, this is the management. If nothing comes out, this is the ideal management until her bladder regains the tone, until her atonic bladder will become, because there is definitely some lack of care in her management, because the patient will tell you that my catheter and my tubing was not withdrawn at the time of instrumental delivery. Her bladder was not constantly, frequently emptied at 3-hourly interval during the labor. There is some breach of care. Until the bladder will regain the tone, we will intermittent self-catheterization so that we can prevent the bladder to become atonic, right? We can prevent her from getting into long-term complication. This is the help that we can provide. This is the help that we are here to provide. This help will be provided by MDT. This help will be provided by consultant. So we are telling her all the options, that these are your options. And this is the way, until your solution condition is sorted out, until then we can do intermittent catheterization, and then you will become fine and your bladder will regain the tone after some time and your situation will solve, right?
Okay, so basically if nothing comes out in the special test, either it could be either we give her intermittent, or at the same time we can also advise her that to keep the urinary catheter for 1 more week, if at all she is okay with that.
Yeah.
Okay.
Yeah, but not for longer period. Like, it's not like we can say that you can keep the catheter for 6 weeks, you can keep the catheter for 1 week. It's not like this, right?
Okay.
Is already getting. No, Ravneet, actually, with the catheterization, we will not do. We will give her a trial without catheterization. If you can go through the flow chart, there is after the withdrawal of the catheter, we will give her a trial without catheter, and then we will assess the amount of the residual urine, right, with the help of ultrasound scan. Got my point?
Okay, ma'am. If it comes out to be less than 700, then we will keep catheter for 24 hours only.
Forget about 700 to 15 this. Patient has reached at the end point of the flow chart. Flow chart has already been done. My patient has told me that 24 hours, 2-week story has already been done. They have done with me.
But
It means
now,
that
ma'am,
the
we have
points
to assess.
Then why are we assessing the residual urine?
Residual urine, because not residual urine, it's all about that whether her condition is fine or not. If the condition is not resolved, when we will withdraw the tubing, then we will do all this management, right?
Okay, ma'am. And ma'am, if suppose the patient is coming at 1 week, after 1 week,
yes,
then we
again
will
the
be doing, then we will be assessing the residual urine, and on that amount we will be following the flow chart.
I don't
After 1 week
recommend
is
it. I
coming.
will not suggest you people to follow the flow chart until and unless patient is in the immediate postpartum period. Like if they are starting the flow chart from, if the patient is starting the story from this point, only then you can start the flow chart. See, otherwise, if the patient starts story from here, how you can go back over there, right? You cannot go back in this scenario. These things had already been done. Patient will start story from here. See, according to the flow chart, we will encourage the women to void within 4 hours of the catheter removal. A further 2 hours can be given, total 6 hours. Document voided volume. Unable to void in and out catheter, residual assessment will be done. If it is less than 150 ml, it will be probably because of dehydration. If it is 150 to 250 ml, we will proceed attempt with the second void at 6 hours after catheter removal. It means we will remove this catheter and we will leave the patient as it is without any catheter. We will tell her that after 6 hours, you can go and you can pass pee and you can feel that if you're okay or not, right? If after removal of the catheter, the volume inside is 250 to 700 ml, then we can insert the catheter, keep the patient inside, or we can send the patient home for 24 hours and we will retry without catheter after 24 hours. If at that point, the amount of urine is 700, at that time, we can send the patient home for the catheter of the 2 weeks. It means this has already been done. Now we will take the story forward, right? From here. These are the points that you have to cover. You have to cover this, just a minute. These are the points that you have to cover in this station. Tell the risk safety criteria, right, for the discharge, and tell the long-term complication. You cannot pass the exam without these two things. Yeah, please.
The patient is catheterized. How she can say that my situation is the same? Shouldn't we give him a trial by removing the catheter and ask her to pass the urine?
She will tell you some story. She will say that after 2 weeks, my catheter has been, like, there can be different stories that she can cook at that time. She can say that my catheter has been removed and now I am unable to pass urine. Like this, maybe this is her visit that after 2 weeks with you, right? The end of the story, right? She can tell you any story at that time. The little bit twist of the story can be there, but these are the points that you need to touch with this patient. Clean intermittent catheterization, urodynamics, ultrasound of the bladder, MDT, antibiotics, urine culture, telling the safety criteria, telling the long-term complications.
So why you have written here that if the urine are more in amount, then we keep the catheter for 2 weeks more, as already 2 weeks passed?
Yes, it should be 1 week maximum, not 2 weeks, right? You can
1
correct
week,
it.
no?
Yeah, 1 week. Not 2 weeks exactly, but 1 week we can keep, right? So this is
then keep
this is exactly all the points that need to be covered in this station, right? But again, what I am getting the point of you people is that no doubt in that the management plan is important. But what I'm emphasizing is that do not miss safety criteria for discharge. Do not miss to tell the safety criteria for discharge. And do not miss the telling the long-term complications to the patient. You can tell as earliest as possible, right? And then you can discuss the management plan. Try to discuss red flags, long-term complications, and the safety criteria in this station as earliest as possible. And many of you will come back from the exam. You will tell me that, ma'am, first or second or third station was this. This is such a frequently coming station in exam. I don't know why this has become their favorite, but this is coming again, and again. Every now and then, students are saying that this is, Ravneet, my dear, safety criteria for discharge is that patient should void after 6 hours of the delivery, right? And patient voided volume should be adequate. Then we should discharge the patient. If patient has been discharged without fulfilling the safety criteria, it means there is a breach of care, right? And we are already doing the duty of candor, and we are apologizing the patient that we will see if there is any breach of care, then definitely we will initiate an incident report, right? So this is how we will take the station. And I have discussed the station in so much detail because I think so that discussing, maybe the volume on ultrasound. Yes, we can measure this on ultrasound scan as well, right? The purpose of discussing the station in detail is that I can give feedback in 1 or 2 lines and I can end the story finish. But actually, you know that I'm habit of digging out things in detail, and I think so we will discuss 2 to 3 stations in this session, but these should be completely passing station, right? Then they get the benefit of the session. Fine, should we move to the next station? Who is the next participant, please?
Can I do, ma'am?
Who is this side, please?
Ravneet.
Ravneet. Sure, Ravneet, let me start the station. And that is also one of my favorite station because that is also very tricky.